Children and youth with co occurring behavioral health conditions and intellectual and developmental disabilities often face significant service gaps during a crisis. These gaps can lead to extended hospital stays and multiple emergency room visits. According to 2023 King County data, 59% of young people seeking long term inpatient behavioral health placements were suspected or diagnosed as having intellectual and developmental disabilities. These youth need comprehensive, community based supports and appropriate residential treatment options to address their intensive needs. Our third legislative priority is to strengthen services and treatment for youth with behavioral health and intellectual and developmental disabilities who are in crisis by sustaining and expanding behavioral health support teams to provide in-home crisis stabilization and extended services, and by growing short-term residential treatment capacity to fill critical gaps in the continuum of care and offer alternatives to long hospital stays. This priority not only addresses the current service gaps, but also contributes to building an equitable and accessible system of care for children and youth in crisis. Mikkel and Jermaine were planning to share their story, and unfortunately, they were not able to attend tonight's event, but they've asked their service provider, Victoria, to share their story for them. And now we will hear from Victoria.
Thank you, Holly. As stated, my name is Victoria, and I'm here representing Mikkel and Jermaine Hayes. I had the honor and privilege of getting to work and support their son for 2 enrollments with our Children's Crisis Outreach Response Systems for individuals with intellectual and developmental disabilities. Hello and good evening, legislators, honored guests, and community members. We are Mikkel and Jermaine Hayes. We are from the 11th District. We are parents to 5 children, and our son is 10 with autism and an intellectual disability. Advocating for our son and his complex needs has not been easy and is very important to us because he deserves to have a chance at a normal life, just like you and I. But this is not always the case. Long waiting lists, lack of proper support in a timely manner, being told he is too young, and even insurance issues have been a few examples of some of the issues we have come across. Since he has been born, those are the struggles we have come across, and because of that, we have had to sacrifice and fight a lot harder. We are not the only ones going through this, but we are here representing families like us, and we hope that soon there will be a change. Behavioral health crisis support services are important to us, because the team was able to take time to get to know our son and establish a bond with him so he felt safe and supported. This helped the services be more effective. Consistent services are a key factor. When you're making your decisions, please remember our story and the many other families who are going through similar situations, just for our children to have the same quality of life we all deserve. This is very important to my family and I. Thank you for your time.